Assalamu alaikum dear students. Today our topic is cervical vertebra. In this we will be studying the various features of the cervical vertebra. We will be studying the various attachment on the cervical vertebra, and we will be studying the various joints formed by the cervical vertebrae. But before going to start our main topic, cervical vertebra, let us first revise that atypical vertebra have which features. So atypical vertebra has mainly three parts: an anteriorly located body, then posteriorly this is the vertebral foramina, and which is surrounded by the vertebral arch, neural arch. So there are three parts: the body, vertebral foramina, and vertebral arch. The vertebral arch have these components. There are two pedicles directing posterior laterally and two laminae directed posterior medially, and the two laminae unite to form the spinous process. They have two lateral processes placed transversely. These are called transverse processes, and they have articular processes, two above and two below. The upper one are called the superior articular processes, and those below are called inferior articular processes. These articular processes have facets for articulation, so these are called articular facets. The articular facets. These superior articular facets are for articulation with the vertebra above, and the inferior articular facets are for articulation with the vertebra below. So now we have revised the parts of a typical vertebra. Now we will start our main topic, the cervical vertebra. But before going to start the cervical vertebra, let us first differentiate between the cervical vertebra, thoracic vertebra, and lumbar vertebra. Obviously the sacral vertebra is easiest to differentiate, so no need of mentioning about that. The cervical vertebra have very unique feature, that they have a foramen in their transverse process. This is a foramen in their transverse process. This is called foramen transversarium or transverse foramen. This foramen is present in the transverse process of the all cervical vertebrae. If we come to the thoracic vertebra, this is a thoracic vertebra. So it has costal facets. So two costal facets on the body and one costal facet on the transverse process. So it has costal facets. The cervical vertebra have foramen transversarium, while the thoracic vertebra have costal facets, and the lumbar vertebra have none of these. Neither it has a foramen in its transverse process, nor it has costal facets. So we can differentiate easily between the cervical, thoracic, and lumbar vertebra. If foramen transversarium is present, it means it is cervical vertebra. If costal facets are present, it means it is thoracic vertebra, costal facet and no foramen transversarium, so it is thoracic vertebra. And if neither foramen nor the costal facets are present, neither of them is present, then it means that it is a lumbar vertebra. There are 7 cervical vertebrae. They are small in size as compared to the thoracic and lumbar vertebrae because they have to carry less weight. They are identified by the presence of foramen in their transverse process called foramen transversarium, and this is the cardinal feature of cervical vertebrae. The third to sixth are atypical, that is 3, 4, 5 and 6 cervical vertebrae are atypical because they have common features. And the first, second and seventh are atypical because they possess special features. For individual identification, they can be identified individually because they have special features. Now we will be studying the typical cervical vertebrae. These are C3, C4, C5 and C6. They are called typical because they have common features, and C1, C2 and C7 are called atypical because they have their unique features by which they can be identified. So let us study the typical cervical vertebrae. This is the superior aspect of C4 and this is the inferior aspect of C3. So we will study both the superior aspect and the inferior aspect. We start from the body. Coming to the body is small and is broader from side to side than from before backward. The superior surface, the superior surface is concave transversely with upward projecting lips. These are upward projecting lips. They are called the uncinate processes and they have their articular surfaces. So this was about the superior surface. Coming to the inferior surface, the inferior surface at the anterior margin, it projects downward towards the intervertebral disc, while laterally in these areas, these lateral margins are beveled. Beveled means these are sloping, it is sloping laterally. They are beveled because they have to form the joints with these uncinate processes. They will have to form joints with these processes. These are synovial joints. And they are called the oncovertebral joints. These are called oncovertebral joints. This is uncinate process and this is other vertebra. So they form joint which is called oncovertebral joint, and the other name is the joints of Luschka. Coming to the vertebral foramen, the vertebral foramen is triangular and larger than the body. This is triangular and larger than the body. Then coming to the articular facet, the superior articular facet and the inferior articular facets. The superior articular facets are directed backward and upwards. They are directed backward and upwards. And the inferior facets are directed forward and downward. Coming to the transverse processes, this is the transverse process. Now we discuss the transverse process. The transverse processes are small and they are pierced by a foramen. This foramen called foramen transversarium or transverse foramina. Each transverse process, this one and this, each transverse process has an anterior root and a posterior root. This is the anterior root and this is the posterior root. So because they are foramina, so there is anterior root and posterior root. Each transverse process has an anterior root and a posterior root, and both these roots end on tubercles, anterior tubercle and posterior tubercle, anterior tubercle and posterior tubercles. So these are roots which ends on tubercles. These two roots are joined with each other by costotransverse bar. This area is the costotransverse bar. So the costal elements consists of the anterior root, the anterior tubercle, the costotransverse bar and the posterior tubercle. The posterior root, this area, represents the transverse element of the developing vertebrae, and the spine is short and bifid. If you look at this area, this is the anterior transverse process, this is the transverse process, this is the anterior root, this is the anterior tubercle, this is the costotransverse bar, this is the posterior tubercle. So this is the costal element, and the posterior root from the transverse element. Now we will discuss the atypical cervical vertebrae. The atypical cervical vertebrae are called atypical because they have their own special features due to which they can be identified. They have their unique features. These are 3 in number, that is first, second and seventh cervical vertebrae. Let us study the first one. The first cervical vertebra is called atlas. It is called atlas because it supports the head of the head. It supports the globe of the head on its shoulders, just like in Greek mythology, the Atlas, which was one of the god and who supported the globe of the earth on its shoulders. It has no body or spine. It is just a ring. So it is ring shaped with no body or spine. It has 2 lateral masses, which are connected anteriorly by a short anterior arch and posteriorly by a long curved posterior arch. And these are the transverse processes. The anterior arch is marked in the median plane by the anterior tubercle on its anterior aspect and an oval facet on its posterior aspect for articulation with the dens of the second vertebra to form the atlanto-axial joint. The posterior arch, this one, forms the 2/5 of the ring, and its posterior aspect here, it is marked by a median tubercle called posterior tubercle. The upper surface of the posterior arch behind the lateral mass. The upper surface of the posterior arch behind the lateral mass is marked by a groove. This is the groove which lodges the vertebral artery and the first cervical nerve. These lateral masses presents the following features: the upper and lower surfaces. This is the upper surface and the other one will be the lower surface. The upper surface and lower surfaces, the upper surface bear the superior articular facet, and the lower surface, which is below it, presents the inferior articular facet. The superior articular facet is concave and elongated. It is concave and elongated. It is directed upwards and medially. to articulate with the corresponding condyle of the occipital bone to form the atlanto-occipital joint. While the other articular facet on the inferior aspect, that is the inferior articular facet, is flat and circular, and it is directed downward, medially and backward to articulate with the corresponding facet on the axis vertebrae to form the atlanto-axial joint. The medial surface of the lateral mass is marked by a roughened tubercle to provide attachment to the transverse ligament of the atlas. The transverse processes project laterally from the lateral mass. The transverse processes project laterally from the lateral mass. They are strong, larger than that of the other cervical vertebrae. These elongated transverse processes act as efficient levers for the rotation of the atlas vertebra. When this atlas vertebra rotates, then these act as levers. The most important features of the atlas is the absence of its body. The body is absent because during development the centrum, mean the body of the first cervical vertebra, this one, get fused with the centrum of the second cervical vertebra, that is axis, to form its process called dens. Dens is a process, a tooth-like process called, which is present on the axis vertebra, which is actually the body of this vertebra. So, and that is why it has no body, because its body is attached with the body of the second cervical vertebra to form one of its processes called dens. So that was about the first cervical vertebra, that is the atlas. Now we will discuss the second cervical vertebra, which is also atypical, and its name is axis. This is the axis. This is its posterior view when seen from behind, and this is its anterior view when seen from anterior aspect. This is called the odontite process. This is called axis because the first cervical vertebra, this one, the first cervical vertebra, which is called atlas, rotates around this pivot formed by the odontite process of the second cervical vertebra, that is axis. So this odontite process of the axis acts like a pivot around which the first cervical vertebra, that is the atlas, rotates. This odontite process, this is a strong tooth-like process which projects upward from the upper part of the body. This is the body, and it is projecting upward from the body. This is the body, and it is projecting upward from the body. This odontite process actually belongs to the first cervical vertebra, that is atlas. It is actually, this odontite process is actually the centrum or body of the first cervical vertebra, because this first cervical vertebra, that is atlas, has no body. Its body is this. This is its body centrum, which is fused with the body of the axis vertebra. This is the body of the axis vertebra. The odontoid process is fused with the body of the axis vertebra, and this odontoid process actually is the body or centrum of the first cervical vertebra, this is atlas. So that is why it is called axis, because it is acting like an axis around which the first cervical vertebra rotates like a wheel. When we look at joints, this odontoid process anteriorly articulates with the arch of the atlas, articulating with the arch of the atlas, and posteriorly it articulates with the transverse ligament of the atlas. Anteriorly, anterior arch of the atlas, posteriorly transverse ligament of the atlas. So this dens is articulating. This odontoid process at its apex provide attachment to the apical ligament, and below the apex on either side it provide attachments to the alar ligament. This is the body, this is its inferior margin. This anterior margin inferiorly, the body's anterior margin inferiorly is projecting downward for a considerable distance. This is quite prominent. The inferior margin of the body anteriorly is quite prominent. The spine, this is the spine. The spine is large, thick, massive and very strong, and is deeply grooved inferiorly from inferior aspect. It is deeply grooved, and it is bifid. The tip is bifid. Coming to the transverse process, the transverse processes are very small and lack the anterior tubercles. The foramina transversarum is directed upward and laterally, and these laminae, these are the laminae. The laminae are thick and strong, and the superior articular facet, this one, the superior articular facets are large, flat and circular. They are weight bearing and directed upward and laterally to articulate with the corresponding facet of the atlas. These are the inferior articular facets. The inferior articular facets lie posterior to the transverse process and are directed downward and forward. They are directed downward and forwards. So these are the inferior articular facets which are directed downward and forward to articulate with the third cervical vertebra. So this was about the axis, the second cervical vertebra, which is also atypical. Now we will study the seventh cervical vertebra. It is also an atypical vertebra. It is also called vertebra prominens because it has a very long spine which forms a prominent palpable projection in the lower part of the neck. The spine is thick, long and nearly horizontal. It is not bifid but ends in a tubercle. The transverse processes are comparatively long and large and lack the anterior tubercles. They have a prominent posterior tubercle, but they lack the anterior tubercles. The foramina transversarium is relatively small and does not transmit the vertebral artery. It transmits only the accessory vertebral vein. All the other cervical vertebrae from C1 to 6, their foramina transversarium transmit vertebral artery, but that of the 7 cervical vertebrae does not transmit vertebral artery. It only transmits the accessory vertebral vein. Now we will discuss the joints formed between the cervical vertebra. These are the joints of the neck. The joints of the neck include intervertebral joints between the lower 6 cervical vertebrae and the craniovertebral joints. The joints between the lower 6 cervical vertebrae are typical cervical joints. These are joints which are similar to those in other parts of the vertebral column. The only difference that here in the cervical region, the supraspinous ligaments are replaced by the ligamentum nuchae. These joints allow flexion, extension, lateral bending, but lateral rotation. The joint between the first and second cervical vertebra and those between the first cervical vertebra and skull allow rotation and nodding of the head. We will concentrate on craniovertebral joints. In these articulations take place between the occipital condyles, the atlas and the axis vertebra. So two types of joints are formed: the atlanto-occipital joints and the atlanto-axial joints between the atlas and the axis, and atlanto-occipital between the atlas and the occipital bone. So first we will discuss the atlanto-occipital joints. The atlanto-occipital joints, there are two atlanto-occipital joints, one on either side, between the atlas vertebra and the occipital bone. These are synovial joints of ellipsoidal variety. About the articular surfaces, above the articular surface is formed by the convex articular surface of the occipital condyle. Above the articular surface is formed by the convex articular surface of the occipital condyle, and below concave superior articular surface of facet of the atlas. So below is concave superior articular facet of the atlas vertebra. So that was the atlanto-occipital joint. Now we will discuss the ligaments of the atlanto-occipital joints. This is one atlanto-occipital joint, this is another atlanto-occipital joint, so these are its ligaments. First ligament we will discuss is the fibrous capsule or capsular ligament. It surrounds the joint and is attached to the margins of the articular surface. Others are accessory ligament. One is this one. This one is the anterior atlanto-occipital membrane. Atlanto-occipital membrane on the anterior side, so it is called anterior atlanto-occipital membrane. It is attached below to the arch of the atlas and above to the margin of the foramina magnum. It fuses with the fibrous capsule laterally, and it is also strengthened by the anterior longitudinal ligament. This is the anterior longitudinal ligament. This is another accessory ligament, which is the posterior atlanto-occipital membrane. It is attached below to the upper border of the posterior arch of the atlas and above here to the posterior margin of the foramina magnum. Inferior laterally here, this one, in this area. Inferiorly, it arches our groove on the upper surface of the posterior arch of the atlas. This groove is for vertebral artery and first cervical nerve. Now we will discuss the movements occurring at the atlanto-occipital joints. Since these are ellipsoid joints, the movements are permitted in transverse as well as in anterior-posterior direction. So movements are permitted in transverse as well as anteroposterior axis. Movements are flexion and extension, that is mean nodding or yes movements. So flexion or extension occur along the transverse axis, and flexion is done by longus capitis and rectus capitis anterior, while extension is done by rectus capitis posterior major and minor, semi-spinalis capitis, splenius capitis and upper part of the trapezius. While lateral flexion, which is very slight, means side to side movement in the anterior posterior axis, that is brought about by the rectus capitis lateralis. Now at the end, the arterial supply is from the vertebral artery and the nerve supply is from the first cervical nerve. Now we will discuss the joint between the atlas and axis vertebra, that is the atlanto-axial joints. These are three well separated joints that are formed between the atlas and axis. One median atlanto-axial joint and the two lateral atlanto-axial joints. All these joints function as one unit. The purpose is to produce movement of rotation of atlas along with the head around the vertical axis of tens. The median atlanto-axial joint, this is a synovial joint of priority. It is formed between the dens of axis vertebra and the osseo-ligamentous ring formed by the anterior arch of the atlas vertebra and transverse ligament of the atlas vertebra. So this is the median atlanto-axial joint. The articular surfaces are on the odontoid process of axis and the anterior arch of the atlas and the transverse ligament of the atlas. There are two articular surfaces, anterior and posterior. There are two articulations, one is anteriorly and other is posteriorly, with separate joint cavities. Anteriorly, a separate joint cavity between the dens and the anterior arch of the atlas, and posteriorly between the dens and the transverse ligament. So these two joints have separate joint cavities. Anteriorly, there is a facet on the anterior surface of the dens which articulate with a similar facet on the posterior surface of the anterior arch of the atlas. Posteriorly, the anterior surface of the transverse ligament of atlas articulate with a facet on the posterior surface of at the base of dens. So this is the articulation at the median atlanto-axial joint. Now we discuss the ligaments of the median atlanto-axial joint. We will discuss the ligament of the median atlanto-axial joint. The first one is obviously the fibrous capsule. It is loose and surround the anterior joint. Obviously the joint is present anteriorly. It is surrounded by the fibrous capsule posteriorly and on sides. It is attached to the margin of the articular facets and it is lined by the synovial membrane. Transverse ligament. Another is the transverse ligament. It is attached on each side to the medial surface of the lateral mass of the atlas. This is the lateral mass of the atlas, and the transverse ligament attaches to the medial surface of the lateral mass of the atlas. In the median plane, the fiber of the transverse ligament are prolonged upward to the basi-occiput and downward to the body of the atlas, thus forming a cruciate ligament of atlas. The transverse ligament embraces the narrow dens and prevent its dislocation backward. It embraces the narrow neck of the dens and prevent it from prevent its backward dislocation. Now the ligaments which connect the axis to the occipital bone. This is the dens of axis. It is connecting the dens to the occipital bone. So this is the apical ligament. The apical ligament of dens extend from the tip of the dens or odontoid process to the upper surface of the basilar part of the occipital bone near the foramen magnum. And this one, the alar ligament, it extends on either side from the upper part of the dens on the side of the tip, to a tubercle on the medial aspect of the occipital condyle. These ligaments are very strong and they check excessive rotation and flexion of the head. They are therefore called check ligaments. Another ligament is the membrana tectoria. This is the membrana tectoria. Membrana tectoria, this is the posterior longitudinal ligament. So membrana tectoria is an upward continuation of the posterior longitudinal ligament. This is the posterior longitudinal ligament, and membrana tectoria is the upward continuation of the posterior longitudinal ligament. It lies posterior to the transverse ligament. This is the transverse ligament. It lies posterior to the transverse ligament. Inferiorly, it is attached to the body of the axis, and superiorly it is attached to the upper surface of the basilar part of the occipital bone above the attachment of the upper band of cruciate ligament. This is the upper band of the cruciate ligament, and this is the lower band of the cruciate ligament. So in the upper part it is attached. So these are the ligaments of the median atlanto-axial joint. Now we will discuss the lateral atlanto-axial joints. There are two lateral atlanto-axial joints, one joint on either side. This is a synovial joint of plane variety. The articular surface, the upper articular surface is formed by the inferior facet of the lateral mass of the atlas, and the lower articular surface is formed by the superior articular facet of the axis. This is the fibrous capsule is attached to the margins of the articular surface. Coming to the movement, the movements are almost exclusively rotation of the atlas along with the head. The atlas rotates along with head around the pivot formed by the odontoid process of axis. The odontoid or dens of axis form a pivot around which the atlas vertebra rotates along with the head. So this is the movement occurring at the atlanto-axial joint. The rotation is mainly limited by the alar ligaments. The rotatory movements of atlas and with the head. When the atlas rotates with the head, this rotatory movements of the head around the vertical axis are called no movements. When some person is moving the head like this, saying no to the others. So these are called no movements. Other is when somebody is sentenced to death and he is hanged. So what happens when he is hanged? Death occurs due to the posterior dislocation of the odontoid process, because with sudden jerk there is rupture of the transverse ligament of the atlas. The transverse ligament of the atlas ruptures. So what happens, that there is posterior dislocation of the odontoid process, and posterior is located the medulla oblongata. So it crushes the medulla oblongata, in which all the vital centers are present, and also the adjoining part of the spinal cord. So death occurs due to crushing of the medulla oblongata by the posterior dislocation of the dens or the odontoid process of the axis.